Good morning, guys. This is Rusty 78609, Central Texas, USA, cruising down the highway. It is 10:16 a.m. May the 4th, 2017, according to my new calendar that I received from a viewer in the mail a day or two ago. But anyway, I just had to, I may not even post this video. I don't know. We'll see. But I was on the computer this morning and I noticed I had an email from Baylor Scott and White Hospital for $53. It said I had a bill for $53. Well, I haven't seen a doctor, my dermatologist. The last time I saw him was in October of last year. And I got a bill in January, which I paid in full. And I verified with the girl. I said, now, you know, sometimes they have these charges that come in later. And she said, yeah, I know. She said, but no, this is it. We have filed with Medicare and you owe $20-something. So I paid it. Well, then I get this little email that says I owe $53. So I call Seton, Scott and White, or whatever they call it. It's a big medical care thing in Texas. And as you know, these billing systems from the hospitals are billing systems from hell, okay? I mean, you get a bill from 15 different people that you've never heard of, and you went to see one doctor. I went to see a dermatologist, and all of a sudden this stuff starts popping up. But anyway, to make a short story long, talked to the guy at Seton, Scott, or Baylor Scott and White, whatever it's called, and he said, well, this just came in today. And I said, well, man, it's 7 months ago since I saw the doctor. He said, well, this is from the hospital. I said, well, man, I wasn't in the hospital. He said, well, the doctor is affiliated with the hospital, so we get two bills. You get a bill from the doctor, and then you get a bill from the hospital. And I said, well, man, again, we go back, this was October the 23rd, 2016. So anyway, to make a short story even longer, we get Medicare on the phone. We have a three-way conversation. We got the Baylor Scott and White medical chain, whatever it is, and then we've got Medicare on the phone, and we got me on the phone. Well, we get the first representative from Medicare on the phone, and the guy from Scott and White, talks to her and says, you know, gives her some information. Then she asked me some information and so forth. Finally found the claim, and she said, well, I don't know. I'll have to send you up to a specialist. Okay. So then we're on hold to get to this specialist at Medicare. This specialist gets on the phone and, it finds the claim and explains that, yeah, it's two different claims. One's from the hospital, one's from the doctor. And I said, well, you know, I don't care who it's from. I don't feel like I owe it. Because I've been going to this doctor for about 6 years, and this is the first time this has happened. And the guy from Scott and White said, yeah, well, you know, we made some changes, and so what happens now is the doctor submits his bill, and then the hospital submits their bill separately for the facility usage. Well, the total claim, folks, now this, I went into a dermatologist. It looks like I'm running a red light, but I'm not. But anyway, the total claim, now I went to a dermatologist and I was in his office approximately at the outside 15 minutes. He didn't do anything. He didn't burn anything. He didn't cut anything off. He just looked and said, okay, you're good to go. We'll see you in a year. 15 minutes. The total claim, $1,753. $1,000 to the doctor and $700 and something for a hospital usage fee. These people are insane. I mean, no, if any political group can untangle this system of greed, I would be extremely impressed. I mean, this thing is, it's a monster. And besides that, nobody knows what these bills are for, because I said, okay, did my Medicare should have paid 80% of that $50, so then I owe, it'd be 40, I owe like $13 and something. No, this wouldn't be included in that, because this is a blah, 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 whatever they said. I said, man, I don't know that. You guys are just saying these things. I mean, but anyway, what it ended up with, I said, okay, here's the deal. I mean, when I get enough, I get enough, okay? And I got enough. I mean, if I owe it, I don't mind paying it. But whenever you start this, well, you know, we're not sure, but, and, you know, it kind of looks like, or, you know, it should have been, you know, they should have filed it, you know, by, you know, the end of December, so it was included in the deductible year 2016, but they didn't, and it rolled over into 2017. So, you know, then I said, well, you know, my deductible for 2017 was satisfied in March. He said, well, yeah, but this bill is dated January, so your deductible wasn't satisfied. I said, well, you know, but whose fault is that? But anyway, enough said about all that stuff. Two things that have stuck in my mind, and I'll finish the other part that I started earlier. Two things have stuck in my mind. One is, do I really need this frustration? No. Can it be avoided? Very easily. You know, give you a bill that shows, you know, doctor's visit this much, you know, total due, that's it. Don't give me all this other crap about a hospital usage fee and some jargon that I don't even know what the hell they're talking about. But anyway, back to the amount due. The conversation ended with me and the gentleman, or whatever it was, from Scott and White. He said, yeah, well, you know, the balance shows you $53. And I said, well, here's the deal then. Two things are going to happen. Number one, I'm not going to pay the $53 because in my mind, I do not feel like I owe it. Okay? Why do I not feel like I owe it? It's because I contacted your billing office when I paid the balance they showed at that time in January of $27 and something. And I said, now, okay, I'm going to pay you $27. Are there any other charges that may come in later? No, this is it. This is the total bill, blah, blah, blah. So I feel comfortable with that. So they're just going to either eat the 50-something. And I said the second thing that's going to happen is, if I continue to get follow-up bills for this $53, then I'm going to contact Dr. Ransdale's office and advise them to cancel all future appointments, and I'll find somebody else, because I do like to go to two different dermatologists, because beauty kind of is in the eyes of the beholder. Right now I go to a woman dermatologist and a man dermatologist, because men and women have a tendency to see colors a little differently, and whenever you're looking at skin color, skin cancers, you want to be sure that you're getting 4 eyes on it. At least I do, because I don't want to end up with that crap. But anyway, this is just a little heads up on the frustrations of dealing with doctors and hospitals. I thank God I don't have to go to them often, and I go to the dermatologist by choice, because I grew up on a farm in Central Texas, and we were out in the sun a lot, and I know that you know, there are people that die of melanoma and other types of skin cancer, and I don't want to be one of them. So here I am at the post office fixing to check the mail. But anyway, that was just a short story that I stretched on into something else while I was taking a drive through Kingsland, Texas for you new guys. That's what that was, the little community. And that's where I'm at right now, because I'm fixing to check my mail. And why do I pull up here like this and back in? Because this parking lot was designed by one of your post office engineers, and I don't know if you've ever gone to post office very often, but you will find that some of their parking lots are a little bit difficult to get in and out of without having an accident. and particularly up here because the average age in this county, this happens to be in Llano County, this is the oldest average age county in Texas, I think. That's correct. But having said all that, guys, I'm fixing to go check the mail now, so I'll end this video. But for those of you that have to deal with Medicare and health insurance and hospital billing systems and doctor billing systems, believe me, I empathize with your total frustration, and it is just totally unnecessary. But anyway, having said that, guys, thumbs up, carpe diem, adios, bye-bye, buy USA made when you can, drink plenty of water. 3 quarts a day will not hurt you. You may pee like a racehorse or 2 or 3 peckered possum, but you'll feel a lot better and you will get to know your restroom quite well. Take deep breaths, breathe in through your nose, out through your mouth several times a day. Why? Because it relieves stress. Relieving stress will lower your blood pressure. Lowering your blood pressure will make your heart not work as hard, or won't have to work so hard to pump the blood, and you'll feel better and you'll live longer. And I want you to live longer because I'm going to get my camper. I've got all my stuff ready for my camper top. It's just a matter of getting the camper top. I've got, you know, it's kind of like I've got the cart so far ahead of the horse that you may never catch up. But no, I've got the stuff ready. I mean, you know, I'm ready. It's just a matter of getting that camper top and going. Hopefully it'll be here next week. We'll see. But anyway, guys, enjoy your day, and don't let these medical billing systems get you down. I say that for my own benefit. But anyway, guys, adios amigos. Bye-bye.